Jessica served. Jessica served as a legislative director and senior policy advisor of Texas State Senator Rodney Ellis. She also has prior experience in clinical care, clinical research, and education. Jessica holds a bachelor's degree in biology from the University of Texas at Austin and a master's degree in public health from the University of Texas Health Science Center. I'd like to introduce Jessica. Thank you.
Great, thanks, Jamie. And thank you all for being here today. We have some great folks from HHSC here to give us an update on the 1115 waiver. Brittany Bills, who's the director of 1115 waiver strategy, is going to be one of our presenters. The 1115 waiver strategy director position is a newer position at HHSC, and so they're responsible for coordinating strategy and development and planning for the future of Texas's 1115 healthcare transformation and quality improvement waiver. Many of you know Brittany from her work going back to 2004 in government relations at HHSC between 2007 and 2009 at the Texas legislature with the Senate Finance and House Public Health Committee, and most recently as an independent consultant. Brittany brings deep knowledge and experience in Medicaid and the 1115 waiver financing and policy DSRIP operations and rural healthcare. Brittany has a master's degree in journalism from the University of North Texas and a bachelor's degree in business administration from Baylor University. We'd also like to welcome Trey Wood, who's the Chief Financial Officer at HHSC, and he's responsible for the overall financial management of the agency. Trey has served as CFO since August of 2017 and assumed leadership of Financial Services Division after an agency reorganization in March of 2020. Trey has more than 14 years of state government experience, working almost exclusively in areas of accounting, audit, and budget. Prior to joining the state, he worked in the private sector conducting healthcare-related audits for states of Texas, Oklahoma, Virginia, USCMS, and other federal government entities. Trey earned a bachelor's degree in economics from the University of Texas at Austin as a certified public accountant, certified internal auditor, and certified information systems auditor. So thank you both for joining us today. We really appreciate the work that you all have been doing on the 1115 waiver and your expertise over at HHSC. We wanted to see if you could provide an update on the 1115 waiver. We know a lot has gone on since the state renegotiated the waiver in January and since CMS has rescinded the waiver earlier this year. Can you provide a brief background on where we are kind of in the waiver process and the history that's gone on so far for folks? Thank you.
Good morning, everybody. Yes, my name is Brittany Bills, and I'm the director of the 1115 waiver strategy, and I appreciate you guys having us here today. And Trey Wood, our Chief Financial Officer, is here with me, so I'll let him also share with you. But just to kind of bring us all to the same page, I still get a lot of questions about which waiver are we under, which waiver are we working on. And so we are currently working with CMS on the January special terms and conditions and waiver package that was approved in January of 2021. And that includes a lot of great things and a lot of various components. And so under that waiver, and I see Amanda sent some questions, and so I will just touch briefly on the fact that it includes things around the pending state-directed payment programs. It includes things around the new public health provider charity care pool. And it also includes the things around DSRIP, and that will be where we look at a DSRIP extension under those terms and conditions. And so we are working under those waiver terms and conditions, and we're working fast and furiously on new reporting requirements around even home and community-based reporting, and our new evaluation that we'll be working on with CMS. And that was submitted in January. And then CMS has also let us know in our last monthly call that they have some technical corrections that they're going to be making to the January packet. And those include, they're highly technical, but one of the things that most of you are probably familiar with is the attachment J, the district protocol called attachment J. And it was inadvertently the wrong version was included in the January packet. And so it's not, they're going to just sub it in with the new version. There was a new version that was approved last year. And then we have 2 new approvals, the non-emergency medical transportation approval, and then some COVID protocols called Appendix K that are going to be incorporated. And then there was a date that was wrong. So there are technical changes that they have that they're wanting to make to those January STCs, but that is where we are, and those are the STCs that we're under and that we're working towards successful implementation on. And so that's kind of where we are with the waiver. There are a lot of other things that are happening, but I will, at this point, we want to make sure we address any questions that you have as well. So I'm going to turn it over to Trey and see if Trey wants to give any brief remarks about where we are and what all is going on, and then we can work on your questions. We may have lost Trey again.
Trey, it looks like you're muted.
What about now? Can you hear me now?
Perfect.
Okay. Well, that's weird. I'm having to use the phone, so I don't know what, I didn't change anything, but okay. So just as a addition to what Brittany said, you know, the federal Eastern District Court judge of Texas did put an injunction in place, which requires CMS to continue to honor the terms of the 1115 waiver that was agreed to with the state in January. So we are continuing to operate under those. We're actually operating at this point under both the prior waiver and the new waiver. We're meeting all the obligations under both, which is additional work for everyone. But you know, the state is making its best efforts to be in compliance with both at this point. We are still going through the process of doing the waiver extension in case the lawsuit does not result in maintaining the waiver that was agreed to in January. So we are continuing to pursue a waiver extension as well. So in essence, there's kind of 3 different ways that we're going about this. And all of that, that's all related to the waiver. And then separate and apart from that, we are obviously continuing to work with CMS on the approval of the directed payment programs, which we can get into quite a bit here as part of our discussion, and working through any of the issues that they have raised with those. I will say when we got to the end of July, at that point, CMS had indicated that they had all the information they needed from us, and that they didn't need anything else. And then about a month later, they sent us another document that indicated they had about another 19 issues and questions for us that we have now since been working through with them. And what we've done is we posted that communication, that correspondence out on our website so that folks can see what CMS is asking and what our responses to these issues and items are, so that we're trying to be as transparent with everyone as possible, so folks know what's going on and know what the areas of concern that CMS has. And so that folks are aware of those things. So depending on how some of this thing settles or ultimately what the state ends up doing, you can kind of see why some, you know, if we ask for more information for whatever, whether it's a quality thing or reporting on additional information or data, you can maybe see why. It's because CMS raised a concern with something at some point in time in the process. And so that's as part of our response to meet their concern. You know, we this is how we sought to address it or work with them to get it approved. So we continue to have some of our supplemental and directed payment programs. So I'll kind of stop there, just kind of as a summary, and then we can kind of go into whatever questions y'all may have and maybe speak a little bit more specifically about certain circumstances. So.
Great, thanks, Trey and Brittany. Trey, can you elaborate a little bit more and explain what the extension of DSRIP, Europe, and QIP will mean in relation to the directed payment programs that y'all are working to try and implement?
Yeah, so a couple of things. The first thing I'll point out is we have not heard back from CMS on whether they have agreed to the extension of DSRIP, to the extension of Europe and to QIP. They have indicated they are open to that. We sent them a follow-up letter last Tuesday, I believe, basically saying we are willing to accept these. Here's the information. We have not yet heard back from CMS on that. So we don't yet know what their position is, whether they are accepting our acceptance in essence. So we are still waiting on that. Separate and apart from that, though, we are still continuing to meet with CMS every 2 days as required by the terms of the 1115 waiver extension to try to work through whatever issues they have and ask them questions and probably more specifically answer whatever questions they may have and provide them whatever information they need on the directed payment programs. We don't yet know, how this will play out in terms of is CMS going to just accept a DSRIP extension and accept QIP and accept Europe, or do they want to maybe just go back and approve the DPPs? Because we have made quite a bit of progress once the judge kind of got involved and kind of required CMS to continue to follow the terms of the 1115. So I can't exactly tell you where we're going to be in like a month. I don't know. I mean, if you had asked me like a month before or 2 months before or whatever, where we would be, I wouldn't have guessed at each stage where we would be. So I hesitate to even fathom a guess where we'll be a month from now. But like what we are doing is in essence trying to keep all avenues of this open and moving forward so that no matter what, we can pivot quickly. I will say the challenge with that is none of these programs or none of these things are designed to pivot quickly, which is part of the challenge. I'm sure most of y'all are aware, but we submitted all of the preprints for these programs back in March of this year, which is well ahead of CMS's recommended 90-day timeline. In essence, we submitted it, I think, over 150 days before it was due and required to be submitted, and we didn't get approval. And so that puts the agency in a tough position. That puts the managed care organizations in a tough position. That puts the providers in a tough position. So we are certainly sensitive to all of that, and we are doing our best. And to that extent, like I said, we're trying to keep all avenues open and moving forward so that no matter what CMS ultimately decides, we can proceed down that path. It's just a challenge in doing so because, like I said, none of these things are really designed to pivot on a dime, and that's what we're having to do at this point. And so it's just a pain point for everyone involved. So.
Great, thank you, Trey. That's really helpful. Can you talk a little bit more about either Trey or Brittany about the DSRIP program? We know that you have asked for an extension. If that extension were to be granted, kind of the timeline of what you're looking at for implementation of DSRIP. We heard 120 days. Is that still the timeline that y'all are working off of?
Sure. So I'll take that. So we have there, in order to proceed with an amendment under the DSRIP, under the 1115, we will be submitting the official documentation. So you'll see, let me pull back up these questions real quick because I know that you all had a lot of questions about this. So the RHP structure is in the 1115 waiver structure. The COVID-19 updates and protocols are in those attachments. So those will all be updated in our submission to CMS. So to Trey's point, we have these pending state-directed payment programs that are all pending in front of CMS right now. And so what the DSRIP extension requires is a new protocol and a new submission. And the STCs require that submission be 120, I think that's the 120 days that you're talking about, but it requires that it be 120 days prior to what we want our implementation or effective date to be. And so there will be like a kickoff for all of that. It starts with something called our tribal notification, where we start notifying the tribes of our intent to make this amendment. And it has a lot of different requirements around the transparency for that, and it'll be in the register. And then you'll see what the language actually will look like in all the different protocols as they go to CMS for approval. And so that in general is kind of our timeline around preparing that paperwork to go to CMS and then submitting it to CMS for their consideration and approval. But it's what we call it will be an official amendment to the 1115.
Great, thank you, Brittany. And we know with the extension of the district program that CMS has required some equity measures to be included. Has HHSC had more discussions with CMS on what those will look like going forward, or are the existing measures going to be utilized to meet that requirement?
Sure. So hopefully you've been able to see kind of the questions and answers that we've gotten back and posted out on the website. They're still pending. So as of just yesterday, we're still looking at what those measures would be, and kind of what all the context and kind of where we would be around them. I will note that we've received a lot of good feedback and recommendations from various stakeholders. And so I would just reiterate that if your organization has things that you'd like for us to consider, please make sure you can send those to me, or you can send them to the Healthcare Transformation Waiver team to make sure that they are aware of different measures that you might be ready to report on. Not everybody might be ready to report on them, but I know that they're collecting all those measures, and we've received a number of I'm soliciting the feedback, but we've received a number of, I would say, unsolicited offerings around what those health equity measures could be. So please don't be shy about sending in your recommendations and your ideas.
Great, thank you, Brittany. We also had a question about the 1115 waiver in regard to district continuing, but also if the CHIRP program is stood up in that same year, how reporting would be expected. And y'all might not have answers for that, but if you do, on how that transition will work for providers, and if providers will be expected to finish out the year with their district reporting and also add in additional CHIRP measures.
Now, I'm going to let Trey go. Sorry, Trey,
I can start on this one. And this one may be one of those ones where we don't have a good, clear answer on this. I don't necessarily expect that we would have DSRIP and CHIRP. It would be probably, at the end of the day, one or the other is most likely what would occur. And I think that'll be up to CMS's discretion what we end up having. And that's part of that unknown that I was speaking to earlier, that we just don't yet know what they're going to be willing to accept and approve for the state. So I mean, it would almost be great to have both. I mean, it's more work, but it's also more money. And obviously I'm a financial guy, so more money to me is always good, but I also recognize that there's more work there. So, but I don't know that I would necessarily expect both. So it'd probably be one or the other would be my guess. But at this point in time, I just don't think we know. I mean, like I said, we're working through the issues with CHIRP as we work with CMS and the directed payment programs. If we can't come to some conclusion where we are able to address all of their concerns, then that may be where we end up with a DSRIP extension, and then we may not know about this for another year. So I think that's one of those big unknowns we just have at this point in time. So
great.
The only thing I will note on the reporting, I know that we've gotten a number of questions about reporting, like on tips in October. And so the team is looking at all of that because if, to Trey's point, if we were to receive approval on the state directed payment programs today, we want to make sure that we're ready and we have the systems ready to go to make those payments to y'all, because we were sensitive to the fact that those payments stopped and that there are no payments at this point. And so the team is looking at that. If you have ideas about that, I will just again make the solicitation to let us know what you think might work. for you and your organization for kind of to making sure that we're still getting the reporting done that we need in a timely fashion in order to make sure those payments are going out. We don't want the delays to further delay the funding.
Great. Thanks, Brittany. To the degree to which you're able to, can you clarify the reporting timelines overall for DY10 and DY11 due to the changes in the extension, or possible extension of DSRIP?
Sorry, I was looking for my unmute. So for DSRIP reporting, all of that will come out when we're working through that. So the goal is that, generally speaking, the goal is that the DSRIP extension will be just a planned extension. So everything will, for the most part, as I understand it, stay kind of status quo. So as you have been kind of looking at your calendar year, the calendar years will remain your performance years, et cetera. But I will say those details are being worked through kind of because we'll have to submit those in paper in paper to CMS. So I don't have anything hard and fast right now other than to say generally our goal is that this would look like just an extension of our current DSRIP program.
Great. And so with that DSRIP extension, will there continue to be monitoring audits required for the extension year? I imagine CMS would require those as well.
That's a really good question that I have not even heard brought up. So I will take it back to the team and ask. I am not sure, but I know that there are a lot of parts of that. So.
Okay, great. And then we had another question with regard to the DSRIP extension. Are there any budget neutrality issues associated with that? I know you all are probably negotiating this, but will CMS allow the state to be held harmless with regard to rollover for the future waiver?
So that's a complicated question. Under the terms of the current 1115, in essence, the answer to that question would be no. Because those terms have already agreed to. So we wouldn't be renegotiating those. Some of that might play out differently depending on what CMS, either if they approve a DSRIP extension or if they don't, and we get the DPPs, it's just going to mean different things. So again, it's just a bit of an unknown. If we don't end up with DSRIP and we end up with the DPPs as we submitted them and requested them, then there really is no impact at all. If we end up with a DSRIP extension in Europe and QIP, there will be an impact to some of the rollover savings, but what exactly that will be, I can't tell you today, just because we don't yet know what the final numbers are going to be related to some of those programs. So again, that's part of what we're talking about with CMS and coordinating with them on right now. I just know that under that scenario, some of the rollover savings would be eaten up by the DSRIP extension, and we wouldn't have as much available for the future. That's why when we originally pursued the 1115 extension and coordinated with CMS on these new directed payment programs back in December and January, that's why we went about it with that strategy and that route. That was the best thing for the state, both in the short term and the long term, really. In terms of funding being available for the state. Unfortunately, we have not been able to get approval from CMS on those. And if we go a different route, if we go with the DSRIP extension that CMS has offered, that's going to ultimately impact budget neutrality in a negative way and reduce the total size of programs that we could have over the length of a waiver extension. But again, what exactly that looks like, I can't tell you today. There's just too many variables that are still at play that, depending on what happens with A or B or C, is going to impact that total dollar amount that's available down the line. So how's that for a really solid non-answer,
That was a solid non-answer. Thanks, Trey. That's helpful. We do know that y'all are continually meeting with CMS on these issues. We did also get some questions with regard to the public health provider pool and the charity care pool. We had heard that could possibly be starting in October of this year. Can y'all share an update on where that program is for the state?
Yeah, absolutely. So we're still, we had submitted our documentation and information related to this, I believe, back in April to CMS to continue to stand up the program. We didn't hear anything from them for, I think, 4 months on it. And it really wasn't until the judge got back involved and put the injunction in place and said that, no, the waiver still is in effect. And that's where those terms of that public health care providers charity care pool live is inside the waiver itself. So when we talk about the waiver, the waiver extends, the authority for doing managed care and the budget neutrality component and both our UC pool and now this public health care providers charity care pool. The DPPs kind of live outside of that. They work a lot with the waiver, but they live outside of that. So I say all that because, the waiver is specific, and that's where we have the authority for this new public health care providers charity care pool. So once the judge got involved and put the injunction in place and really said, no, CMS, this waiver is still in effect, CMS finally kind of responded to our information that we had previously submitted, and I believe they've now asked questions about it, and we're still working towards that October 1 deadline, which is that October 1 start date of the program. I'm hoping that's where we can still hit, but again, in essence, I think about 4 months were lost because we never, from the time that we submitted information to CMS and not hearing anything back. So hopefully we can still hit that, but again, most of that is really up to CMS whether that target is achievable. So.
Great, thank you. With regard to that program, for providers who are eligible for DSRIP, currently participating in DSRIP, would they be able to participate in both programs, the charity care pool and the DSRIP program going forward?
Man, I'm not really an expert on who's eligible for what. I mean, if they fall under the criteria that we've established, then yes. I don't know how much of an overlap there is between the two different programs, between DSRIP and this. I think there's a little bit, but I mean, it depends on the eligibility criteria that was initially established when we were working through this with CMS. So if they meet that eligibility criteria, then yes, certainly they would. But it's not a one-to-one. And I think that's an important component, important thing to note, that it's not possible, it was not possible to do a one-to-one replacement for DSRIP. And in terms of the providers, either the amount of money they were getting or who it was eligible under DSRIP, just because DSRIP was serving a different client base. And when it was established, about a decade ago, it was set up very differently. And so it was just not possible to do a one-to-one. So, if you're eligible for both, then yes, you would be able to get some of the funding under the public health care providers charity care pool. But I without knowing, I know it's not a one-to-one, and that it's not everyone that would be eligible under DSRIP that's going to be eligible under that program. Some of those folks may be eligible under some of our different programs. We tried to have a number of new programs to capture as many providers and provide that same level of funding, but I also know it's not a one-to-one, and it was not possible to achieve that. So.
Great, I think that's very helpful. I know a lot of behavioral health providers and public health providers that are working in DSRIP. We're very excited about the charity care pool, and we do think that that'll help offset some of the charity care associated with hospitals and other caregivers. So we do appreciate that pool will be starting this year. Under the waiver, can you also talk about the UC program for hospitals? We know under the current January STCs, there was some resizing requirements. Is HHSC still proceeding it as if those timelines are in place?
Yeah, we are. Again, I alluded to that a little bit earlier when we talked about, in essence, we're operating under both waivers right now. So we're doing everything that's required under the current waiver that expires a year from now. We're following all those terms and everything. But then, yes, as part of the extension that was approved in January, there are some resizing activities that occur for the what I'll call the main UC pool that is part of that waiver. So we're going to be working through those. I don't think the first resizing, I honestly don't remember the timeline, but it's not this year. I'm not even sure if it's next year, if it may be the year after that. But in essence, yes, we are still following those timelines that are outlined in the 1115 waiver extension, which includes the resizing of UC as well as a resizing of budget neutrality at 2 different points in the life of the waiver as well. But again, those are down the road, and a big part of the timing on certain of those was to get past COVID. because with the COVID going on, that really impacts our data a lot in ways that can't really be predicted and can skew things in our favor and can skew things out of the state's favor. So one of the kind of the key points that we were working through with CMS when we did the waiver extension was to kind of identify time periods when we would do resizing activities that would attempt to minimize the impact of COVID, because that wouldn't be fair to the state or to CMS in terms of coming up with accurate program sizes or pool sizes for those activities. So we wanted to try to take COVID out of the equation as much as possible. So.
Great. Thank you, Trey. We do have another question on what is the likelihood of CHIRP reporting being required in October of this year? This person said it's a huge lift for providers. They're spending a great amount of time and effort to obtain data and hesitant to continue with this uncertainty. Does HHSC expect to push out CHIRP reporting as well as other DPPs? And I know you guys had mentioned there's still negotiations, but any insight you can provide on that would be helpful.
Yeah. Again, this will probably be one of those things where I give you all a really good non-answer, which is I just don't know. And maybe that's a terrible non-answer, actually. Again, that's part of that extension with CMS. If they end up saying, hey, we're going to do a district extension, a Europe extension, and a QIP extension, then obviously we're not going to have CHIRP, and we're not going to have some of those quality reporting requirements that were going to be outlined under CHIRP. If they end up saying, well, we're not going to do that, and instead we want to go ahead, we've made progress on the directed payment programs, and we want to go ahead and roll those out because it makes more sense to CMS, then yes, we would. But we would have to coordinate with CMS and let them know, hey, look, there's obviously, because of the delay and everything, there is an implication and an impact to both the agency or to the MCOs and the providers. So I would hope that we could also, if that is the direction that we end up going collectively in an agreement with them, that we can coordinate with them also on, hey, what kind of accommodations can we now make? Because we are 2 months past where we normally know what we're doing for a year. We know about 45 days before the start of the year. Not only the year's already started and we're 15 days into it. So it's a challenge for everyone. So I would hope there would be some accommodation from CMS on that. And we would work with them as best we could on those type of things, because obviously that would not really be fair to the providers or to HHSC or to anyone involved. So, again, it's one of those things that unfortunately, we don't necessarily control. So, but we would certainly bring up those concerns and do our best to work with CMS to see what accommodations could be made. So.
Great, thank you. That's very helpful. And then another question we had, which maybe y'all may be still negotiating as well, is can you discuss the options for carry forward with DSRIP?
So again, I think that carry forward, if you have a recommendation on it, I know I would recommend it to the healthcare transformation waiver team, because they are drafting what that's going to look like. But that is something that we will, it will be a part of the negotiation with CMS, and we will make a request and see where it goes.
Wonderful. Thanks, Brittany. And Amanda and Jamie, I think that's all the questions that we have on our sheet. Are there any other items? Please put your questions in the Q&A box for Brittany or Trey, and we'll try and get those answered. Otherwise, I think this has been very helpful and informative for members on the call. We really appreciate your time and all of the work that y'all have been doing to make sure that Texas Safety Net is stable going forward, and that these providers are able to get to payments and to continue to provide healthcare for their communities.
So I think I saw a question come in that I didn't hear an answer to, and that was, do you anticipate with the district extension that the cost and savings data or template would be required for that extended period of time for that extension?
My only sense right now is that generally we are going to continue those things we're going to continue what we're doing going forward.
Okay. So you anticipate continuing the cost and savings, but also the auditing activity that we've experienced over the last?
I I would not anticipate radical changes, no.
Okay. So then the other question, and I think it might have been asked, but in the past we've had, as anchors and as regions, we've had to submit an RHP plan. Do you think that that would also be required for this extension?
Because it's it's a 1-year extension versus the RHP plan looking forward over a number of years. I have not heard an RHP plan contemplated because again, kind of generally, I think people are thinking about this this is a 1-year extension of what you're doing.
Gotcha.
And going forward. And so again, kind of even in thinking about the COVID and the public health emergency impact, like the goal would be to have it 1 year moved forward, if possible. But I think more details will come out on that if there is a reason that y'all want to see that happen. Again, I think that would be helpful to know.
Okay, thanks. And then I think the one more question I saw that was that you mentioned that there were technical changes that were being made to the SDCs. Do you have a timeline for when those might be approved and when providers would know what they are?
So as soon as we talked with CMS about this on our monthly call last month. So it was just last month in August. And so I mean, they're so technical that they could come any day, and CMS pretty much has a lot of flexibility on when they issue these. These were all things that we talked about in January and February. And so we already kind of had a list going, and we just added the 2 approvals that we've received this year as well to that list. But they did not give us a timeline. They just said that they're trying to pick up where we left off in February in our conversations, and get those technical things kind of done.
Okay. All right. Thank you.
Sure.
Jamie or King, did y'all have any questions? Okay. All right. I don't see any more questions in the Q&A. All right. Well, do y'all have any last thoughts? I guess Jessica or Brittany or Trey, you guys seem to be in the mix of things, so we're definitely interested to hear what your thoughts are.
I don't know that we have any others, or at least I don't know that I have any others right now, other than just, it is a very uncertain time until we can, hear back from CMS in terms of what direction they're going to proceed. So I know it's a tough place that it puts all of our partners, y'all, with this uncertainty. So again, I know we are certainly empathetic to that and wish we could do more on that. We have done our best to try to submit things to CMS as early as possible and answer all their questions. So we're doing the best we can on that front. If there's any assistance y'all can provide, that would be helpful to the situation as well. So I just want to thank y'all for being partners with us in this. So.
Yeah, and I would just echo Trey's sentiments. I mean, CMS has repeatedly acknowledged that they want to help stabilize the Medicaid healthcare system. They want to maintain a sustainable hospital reimbursement. And so to Trey's point earlier, we have tried to put everything before them that they can approve in order to do that. I also would say that our Texas team is very sympathetic to the September 1 coming and going. And I think my sense has just been that our leadership team, with the letter that went out September 7th that Trey referenced, I mean, it is our passionate way of trying to be ready to do whatever we can to partner with you, and making sure that we are providing options for CMS to approve and to move forward with a sustainable system. So we're going to continue to meet with CMS every 2 days as long as we have to seek that final approval on the directed payment programs and try to and stabilize our budget neutrality and the program going forward. We have almost 5 million Medicaid clients in Medicaid right now, and so this impacts 95% of them because they're all in Medicaid managed care. And so we appreciate all that you're doing to help partner and to serve our Medicaid population.
You know, and I have to say that you all are so appreciative of the work that the providers and the anchors are doing. And I'm not so sure that we always say thank you enough, but thank you to both of y'all and y'all's teams, because I know that it has to be frustrating and overwhelming at times to kind of muddle through all the ins and outs of what CMS wants and not hearing back and whatnot. So thank you to you all as well. So Jessica, Jamie, anything for Nielsen?
Thank you very much for your participation today.
Okay. We appreciate everybody's
Yeah, no
time.
final thoughts, Eden?
Oh, go ahead.
Just wanted to say thank you to HHSC. We really do appreciate the great leadership team that you all have there and the work that you guys are doing to negotiate with CMS.
Yeah, yeah. Some of the providers are chatting as well, saying thank you for all your efforts. So again, thank you for your time and all your support. So, all right. We'll sign off. Thanks.
Thanks.
Bye.